Okay.
Okay.
Hello.
Hello.
Hello. I'm Dr. Mahmoud. I'm one of the doctors in the ward. Am I talking to Mr. Remus Lubin?
Yes, doctor.
Okay. And are you the son of Mr. John?
Yes.
Okay. Just to confirm, are you his next of kin?
Yes.
Okay. Thank you so much for coming to talk to me today. Before I discuss further with you, do you want anyone to attend this meeting with you today?
No, thank you.
Okay. And would you mind if you can tell me how much do you know about your father condition?
Yes, doctor. Actually, my father is 82 years old.
Mm-hmm.
His condition is quite advanced. He was having the Parkinson and developed dementia. And
Okay.
3 days back, he was having some fever. They told me that he may catch some bug in his chest, and he uh, nearly lost his conscious.
Okay. All right. Okay. And how much have you been like are you what is your expectation about your father condition so far?
I think his condition is quite advanced. I think last update that they moved him to the intensive care unit, and yes, his condition is not so well.
Okay. So as you said, Mr. Remes, that your father has been admitted because of severe chest infection, and he has been deteriorating recently, and he also has got like background of advanced dementia as well. So when he came to us, we have discovered the chest infection, and then we have started him on treatment. So we have given him like oxygen. We have also started him on fluids and antibiotics. Despite giving all this treatment for him and the drugs and the fluids, he has not been showing any improvement. And he started to deteriorate further and further. And I'm sorry to tell you, Mr. Remes, I have got some concerning news that I would like to share with you.
What, doctor? What do you mean?
Unfortunately, Mr. Remus, despite all of our effort, your father has been deteriorating, and unfortunately, this morning he died.
My father died.
Yes, Mr. Remus.
I wasn't expected that at all. I thought that he will like survive. He, as every time, like he clearly like was deteriorating, but I have some hope.
Yeah, I'm really very sorry to tell you that, Mr. Remus, and I can see that is unexpected and it came to you as a shock. I completely understand your feeling, and I'm very sorry for you you've been through. Are you okay to continue the conversation, or you want me to give you some water and tissues?
We can continue, doctor.
Okay. So yeah,
Yes. So what, doctor? You are telling that you did all the best. Actually, I heard about something concerning, doctor. I want
yeah,
to share with you. Yes. Actually, I heard from some of the nurses that my dad like missed some antibiotic doses. So I would like to confirm if this was true, because this will change everything if he hadn't received his full medical care during his hospital stay.
yeah. So I completely understand your concern, Mr. Remus, and I can see where you're coming from. And it must be very frustrating that your dad has not received a few of his antibiotics, and that could be something quite bad. However, like when your father has been admitted to the hospital, initially we have done some assessment to assess the severity of the chest infection, and also we have done like assessment to assess for the risk of him passing away or dying from the infection. And at that time, unfortunately, the risk was very high that he might die from this chest infection.
Okay, I understand this, doctor, but why my dad didn't receive the antibiotic?
I can, yes.
Yes, this is clearly not acceptable at all.
Yeah, so I can clearly understand your frustration, Mr. Ramis. However, I was not clearly sure why the antibiotic has not been given to your father. I wasn't aware, and I wasn't there at that time. But what I can do is I can go and investigate that further. I would also check his notes, and I would also speak to the nurse in charge and the consultant just to find out why that has happened in the first place.
Doctor, I want to file a complaint.
Okay, so I'm very sorry that we've given you such much difficult time, Mr. Ramis, and raising a complaint is completely your right, and we wouldn't stop you and it is completely your right, Mr. Ramis. What I can do is I can guide you on how to raise a complaint. You can raise that through something called patient advice and liaison services. They are independent, and they will investigate that further and they will feed that back to you.
2 minutes remaining. Okay, doctor. So really, I want to know the exact cause of death because this changed everything. Maybe if my dad received the 2 antibiotic doses, this will change the outcome.
Yeah, your concern is quite valid, Mr. Ramis. So, in your dad's condition, he has got a severe chest infection that has led to failure to his lungs, and also his infection was quite advanced at that time. But what I can do is I can also speak to my seniors and see whether this need further investigations or not. But we do believe that it is secondary to the infection that he had.
How we can like know 100% sure the exact cause of death?
Okay, so we can refer this to something called coroner in the hospital. So they will see the notes and they will see the cause, and after that they will decide whether we need whether this is enough as a cause for his death, or whether they need to do a further investigation like doing a postpartum examination. But this will clearly be decided by the coroner team.
So what if I refuse to go for this post-mortem exam? Will you go for it?
So this is actually it depends on the coroner. So if the coroner has decided to go for that, it is actually something like illegal, and they need to investigate that further. However, it is early to say. The decision has to be discussed further and see whether he needed it in the first place or not.
Okay, fair enough.
Okay. Do you have any other further concern, Mr. Remus?
No,
I'm very sorry to tell you such hard news, and I can see this is a lot for you to take. And I'm very sorry to give you this information today. We are all here to support you. You are not alone, and we will do our best to be with you through this difficult time. And we can also liaise you to the bereavement service offices if you don't mind.
sure.
Okay. Do you have any further concern or any further questions?
No, doctor, thank you.
Okay, thank you so much.
Thank you. Okay, thank you, Dr. Ala. You did it well. Thank you. Okay, so this is a case actually of a deteriorating case in the hospital. Okay, what do you think, Dr. Ala? This needs
I don't think it is need coroner because we have got a clear cause that he has got a high risk of
yes,
mortality, and there is
yes.
also like a respiratory failure and septic shock. So I think we have got a reason why he passed away.
Exactly. Okay, exactly. So that at that time you didn't need a coroner. This is
Mm,
yes, if he insisted, like if he won't like insisted on that because there is a mistake happened there. Okay, and this is a clearly a mistake that he missed the 2 antibiotic dose. But although there was a mistake, this he already have a high risk of death, and the curve score was 5. So yes,
mm,
there is high risk of mortality in such case, and clearly missing the 2 antibiotic dose did not affect the course of the case. Okay, he will
mm,
die anyway, but there is a
mm,
mistake happened, and if he insisted to know the exact cause of death, at that time, you may consider having what we call hospital postmortem. It is not a coroner postmortem. It is,
Okay. That's
yeah,
true. Yes.
yes, it is. But you know, you were like in the midline. I will refer. We will discuss. Okay, you were not like 100% sure. So at that time, you like didn't ask clearly, didn't answer clearly. You rather
Mm.
like you go for your seniors. It is okay. It is okay. But this case, when it came in
Mm.
the UK or overseas, it's clearly a case of hospital postmortem. So the no rule of the coroner. We already expecting the deterioration of the case, but having a
Mm.
mistake, if the caregiver insisted of knowing the exact cause of death and you want to file a complaint on all of that, you may discuss
Mhm.
with your seniors for what we call hospital postmortem. The main
Mm.
differentiating point is that hospital postmortem, depending on the he need to sign a consent because yes, he is insisting. The hospital don't want to do anything. He's insisting to do this, so he need to sign a consent. If he refuse, you will not go for this. Okay, this will
Mm.
not like delay the ceremony. This will not delay the death certificates. This is the, mo-
Mm.
the main differentiating point. But if
Mm.
the case is unknown during a procedure, like happening the death on arrival to the hospital, this will be a
Yes.
case of coroner postmortem.
Correct.
Coroner is some different identity from your hospital. It is like a legal identity outside the hospital. The body will be taken to the coroner, so the death certificate
Mm.
will be to the coroner. So it will delay the ceremony, all of that, because it is out of your hand. So this is the main
Mm.
differentiating point. So he asked it,
Okay.
but yes, in this scenario, he will ask, he want to know the exact cause. But when you are like offering him the postmortem exam, he may be reluctant. No, no, doctor, I
Mm.
will think about this. No, I don't want. Okay, so at that time, you tell him, yes, you can discuss this with your family. Okay, and if you don't want to do this, we will not go for this.
Mm. Okay. Fair enough. Yeah.
Okay, so these are the main like you need to differentiate.
Okay.
Okay, you did it very well, very, very well, excellent. I have only one point.
Mm.
This scenario, if like you will have the awkward silence when you are the breaking the death of the father.
Mm.
Okay, so after that, yes, you offer the condolences on behalf of all team. You offer if you want some tissue or water. Okay, and there will be some silence. During the silence, the examiner expecting you to deliver the second bad news. There is two bad news in this case. The first one is the bad news of the death. The second one of the mistake. So yes, you wait for a few seconds. If he didn't like tell you about the other mistake of heard about anything, you need to tell him, Dr. Ale. You need to be
Mm.
honest, clear. Tell him
Mm.
there is another concerning news I want to share with you.
Mm.
Unfortunately, during your dad hospital stay, because of some logistical circumstances, there was two missing doses of antibiotic. Try to explain
Mm.
that. Try to
Mm.
apologize about that. Raise an incident report, and that you are already aware of that, and you are discussing. Don't wait for him like to ask you to raise an incident report. No, you are already aware that this
Mm.
has been happened, but clearly missing the two doses is not like did not affect the course. He was already deteriorating, and
Okay.
there's
Yes.
high
Yes.
risk. Yes, high risk of
Okay.
him passing away from the start. Okay.
Okay.
Yes.
Okay. Fair enough.
I waited like for a few seconds for you like to tell me that you didn't, so I have to
Bring
break up
it
the
up.
other point, bring it up. Yes.
Okay.
Apart from that, you need to you started the scenario very well. You started the scenario by asking anyone to attend the meeting, because this is clearly a case of breaking bad news of death. Okay, and you
Mm.
ended the scenario or referring to the chaplain bereavement services. Very good, excellent. Okay, any question regarding this case?
No, Dr. Da, it is all clear.
Yes, there is a medical error. Yes, there is the part of it is a
Mistake.
medical error. Yes, there is a mistake, and you need to raise an incident report and refer to the pulse services. Very good. Okay, if I will mark you regarding this communication case, as regard the clinical communication skills satisfactory, clinical judge will be satisfactory borderline depending on the examiner, because you catch the like you were like in the middle. You said that you will involve your consultants. You will. This is okay. This is okay.
Mm.
But if the examiner like is too like يعني if it's like he's
Yeah.
insisting that you know the knowledge and all of that, he may cut your marks into borderline. Okay.
Okay.
regarding the concern satisfactory, regarding the welfare satisfactory. Excellent, Dr. Ala. Thank you.
Okay, thank you so much, Dr.
Thank
Da.
you. Very nice session with you. All of the others, any concerns, any questions before we end? Okay. So we will arrange for the next session with you, inshallah. Okay, Dr. Ala?
Okay, perfect. Okay, thank you so much.
Okay.
Thanks.
Thank you. Thank you. Thank you.
Bye
Bye.
bye.
Bye.